Good afternoon, everyone. My name is Ian Colbert, and I'm the Executive Director of the Canadian Public Health Association. And I want to welcome you to today's webinar and thank you for joining us. While we are coming together from different parts of Turtle Island, I want to acknowledge that CPHA's offices are located on the ancestral unceded territory of the Algonquin Anishinaabe. So today marks the fourth of our four webinars that have been offered as part of our Net Zero project uh, that has been very generously funded by the McConnell Foundation. So this project is being conducted collaboratively by CPHA and the Canadian Health Association for Sustainability and Equity and the Ontario Public Health Association. Now I'm going to pass things over to Kim Parada, the Executive Director of Chase, who will be facilitating today's session. Kim, the floor is yours.
Thanks, Ian. I'm calling in from the city of Hamilton, which is situated on the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. So this is, as Ian pointed out, this is the fourth webinar. With this Net Zero project, we've been examining the strategies being used by public health agencies to advance interventions that can improve health and health equity while also reducing climate emissions. Today we have three speakers. One is with a public health agency and two are actually not. Two are transit related. We thought we'd kind of go outside to kind of bring in some maybe inspirational ideas. And so our first speaker is Franca Ursidi, who is a manager with Peel Public Health, and she'll be describing how public health has been addressing health and health equity with their work on Greenspace, parks, and tree planting. Franca holds a Master of Science degree in toxicology. She has more than 25 years experience working for local public health agencies. Second, we will have Charlie Mace, who's a sustainability planner with the City of Powell River, and she'll discuss their on-demand transit pilot project, how it's improved service and health equity in their community. Charlie's worked in transportation and sustainability planning for over 11 years in the UK, US, and Canada. And last but not least, we have Leslie Taylor, who works for the Nova Scotia Community Transportation Association. She's going to describe how intra-municipal and intermunicipal transit service is provided to rural and remote communities in Nova Scotia and how that it has improved health equity across the province. So with that, I'm going to turn the baton over to Franca. Oh, pardon me, I'm not. Sorry, Franca. I would just ask you to post your questions in the Q&A module. And if you want to introduce yourself and let us know where you're joining from, please feel free to do so in the chat box. And then we will be posting these presentations on the CPHA YouTube channel, and everyone who's registered for the webinar will have access, be notified when the recording's available. And then lastly, we just ask you to take a few minutes at the end to complete the evaluation survey after today's webinar, because that helps us to know how we might make improvements for the future. And with that, I will hand the baton over to Franca.
Okay. Let me just share my screen. You can hear me okay? Okay. Thank you. And share. Okay. Well, hello, everyone. It's a pleasure to be with you all. I'll start by acknowledging the land in which we gather and which the region of Peel operates as part of the treaty in the land, treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land and continue to do so today. In particular, we acknowledge the territory of the Anishinaabe, the Huron-Wendat, the Haudenosaunee, and the Ojibwa and Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississauga of the Credit. It's a pleasure to be with you all today. My remarks today will focus on the process we are using in Peel to integrate health equity and considerations into our climate action planning and programming. We'll address tree planting and green spaces, but we'll also broaden that a little bit to address a few other areas. Okay, just a quick overview of what I'll cover today. So quick context to the region of Peel, generally how we're integrating the areas we're integrating health equity into planning and programming, and then we'll get into some details on some work we've done on vulnerability assessments and some health hazard data mapping in there, and the tree planting prioritization tool and some health impacts assessments, all of which do integrate this work, integrate the tree planting and Greenspace and health equity components. So a little bit about us in the region of Peel. We're located on the shores of Lake Ontario with a mix of urban and rural land. Two cities, the city of Brampton and Mississauga, and a town of Caledon make up our region. We're just west of the city of Toronto and York region and east of Halton region, with a population as of 2021 of approximately 1.5 million, with continued growth expected year over year, which is similar and consistent with the whole of the Greater Toronto Hamilton area. I will note here that as a public health unit, we are currently, and this is changing for those who are familiar with Ontario context. In Peel, our health unit is a regional health unit currently, and that is, in Ontario, we have different models for how public health services are delivered. Some are embedded in local municipalities, others are independent on their own, and then with us, it's embedded in a regional government. In Peel, climate change action has long been a priority for us for about a decade. It started with enhanced efforts beginning in 2019 when a declaration of a climate emergency was made. And at that same time, we also in public health made or included reducing health-related impacts of climate change as a strategic priority for us. I'll also note here as one of the other strategic priorities in public health is advancing health equity. So while, of course, health equity is a significant consideration in our climate change work, it's also a broader priority across public health. Very quickly, before getting into the details and how, just to define the health equity, just a quick mention of what it is. It's really ensuring opportunity for all individuals to achieve and reach their fullest health potential, requiring a reduction of the unjust and unfair differences between people and communities. Often health inequities stem from social and environmental determinants of health, like income or social status or physical environment, just to name a few. Bringing health and health equity, the health equity lens to the climate change can look differently and include a number of different things. Participating in vulnerability assessments in Peel, we've done it by participating in various vulnerability assessments, and these can be, of course, health related. They can relate to agriculture, natural heritage, water and wastewater, just to name a few of their range. In Peel, Peel Public Health was the first health unit in Canada to complete a climate change and health vulnerability assessment in 2012, and we've recently updated this VA or vulnerability assessment earlier this year to bring the more current climate data and health related information into that document and tool. We also developed tools to identify areas in need of enhanced urban forests, and we'll get into this a little bit, or greater risk to health hazards from climate change. We're currently doing an extensive exercise in Peel looking at the health hazards, the climate change hazards, and doing what we call a principal component analysis at the census tract level. We also bring in and integrate health equity in large infrastructure and development projects, and these considerations when we're asked to comment on either climate change generally or other health hazards. The health equity components are always considered, and we always take that lens to that table as well. Through these examples, we can identify areas that require additional resources and support to improve the social and environment determinants that can impact a community. So I wanted to, look at the vulnerability assessment that we recently updated. It was completed and identified climate-related health hazards for Peel. Vulnerability is dependent on various conditions in each population and is a function of that population's exposure to the hazard, sensitivity to the impacts of the climate hazard, and the adaptive capacity to effectively manage and reduce that risk. And completing these vulnerability assessments for the local context helps us inform decision-making, and data from these assessments can help prioritize those hazards and provide a way or mechanism to identify where the greatest risks are, and pointing to areas experiencing those inequities where there might be inequitable exposures or greater sensitivity or a lessened ability to adapt. But it's really one step in that. Completing the VA is really one step in the process, and ensuring all the necessary aspects, such as the data and its validation, are up to date is really important to support the decision-making and developing and approving interventions and policies that support health equity. Many people and disciplines and expertise are needed for this kind of work, including engaging internal partners, epidemiologists, communication, subject matter experts in environment and health, planning, in order to ensure that it can be used to evolve and to develop and inform our decisions. So our assessment found 5 population groups at greater risk of health-related impacts to climate change, and it also noted the social determinants of health that impact them to increase their vulnerability. Seniors who often live alone and have chronic health conditions, children who often spend more time outdoors, and with developing immune systems, those with chronic illness, they can impact the immune system and limit people's mobility. And those that experience social isolation may lead to reduced coping mechanisms and access to information. And then, of course, social and economic marginalization can increase the burden of disease. So those who are experiencing that marginalization have limited adaptive capacity and behaviors. With this knowledge, program planning and development of interventions can be targeted to support the at-risk populations and reduce the inequities they face. Using data mapping, and I'll get to it in the next slide a little bit, we can pinpoint at various census tract levels which areas in Peel are greatest risk for the health hazard, and we'll make specific decisions to support those populations. And this includes things like Greenspace, where we plan for Greenspace, where we might want to expand Greenspace, where there's it's not in communities when we're planning new communities and new developments, to ensure that that's considered. And it also includes the urban tree canopy in terms of ensuring the coverage for those things. Next. Okay, so this here is this is some work that we're in the midst of doing. The figure is an example of what's being done in Vancouver at this stage. We're doing a similar process where in our vulnerability assessment, key recommendation was to map vulnerable populations and the neighborhood characteristics, which can help identify where targeted interventions are needed in the community. And for we in Peel, we had five top hazards, one of them being extreme heat. And this one here is for the similar one for Vancouver on heat. So working with our epidemiologists and mapping specialists, we've identified key indicators for each hazard and within each vulnerability area. So within the exposure area, the sensitivity area, and the adaptive capacity. And we will identify neighborhoods throughout Peel that are at the highest risk. When incorporating health equity here, we recognize that individuals with a lower socioeconomic status or those being impacted by social determinants of health are often in areas with increased exposure to heat through a variety of factors, including being less likely to have cooling measures available to them, are impacted by ongoing health conditions, and are more likely to be in an urban setting feeling the effects of the urban heat island. With this information, we can target interventions and programs to reduce these inequities. And you'll see in the next slide a tool that we use that has been used to do that. And we can work to reduce the risk of heat-related illness. Just to note here that I mentioned that this is from the Vancouver Coastal Authority. This is document or results of an analysis that they completed earlier this year. So since 2007, so before the vulnerability, first work on vulnerability assessment, the Region of Peel and municipal agencies and partners, which we often work with or work very closely with, were brought together in a Peel Urban Forest Working Group. So this was municipalities and the conservation authorities that we work with. And this working group identified strategies to enhance the urban forest and help communities adapt to climate change. In 2011, this working group, along with many other multidisciplinary partners, and that would include people in the transportation sector, the natural heritage, human health, they came together and they all identified the need for a tool to identify and prioritize opportunities for tree planting within the urban areas of Peel. And they looked at the various economic, environmental, and social benefits that trees in these areas could provide. So this became the tree planting prioritization tool, intended to be a very high level tool to help partners tailor and tailor their activities and meet their respective objectives. Through the development of this tool, health equity was incorporated to improve the equitable distribution, availability, and the quality of green spaces and tree cover across the jurisdiction. It used indicators of income status to identify those areas. And it targeted areas this tool identified areas both that were immediately available for planting, for example, if there was a permeable surface, and also areas that may not be immediately available for planting, but that needed a little bit further investment or collaborative work before that could happen. For example, if there was paved surface or other barriers to the immediate planting. So it kind of provided two tools there. The urban forests contribute to a number of things, of course, to improving air quality, reducing urban heat island, and it provides opportunities for improvement in mental health through time spent outdoors. And we know that in neighborhoods where there's less access to trees and green space, we often see reduced ability to adapt to climate change and greater negative health impacts associated with it. The map that's here is really just a snippet from that tool, just to give you a sense of how, at what level we can kind of zero in on and how it helps us identify those areas. I just wanted to bring the two together here. So this work, both of these tools, activities utilize GIS exercises to provide a mechanism where data helps us identify areas of increased vulnerability, and using the social determinants of health and specific socioeconomic indicators to explain the vulnerability in that context. These tools can be used in tandem along with other tools and activities to deepen our understanding and highlight the priority areas for action, and support the decision makers when they're looking to invest further or to address certain things in various communities. The last area I'll just address, where we have been incorporating the health equity lens, is in the area of large infrastructure projects through things called health impact assessment. Sometimes it's referred to also environmental assessments or development projects. These processes can help identify potential health impacts associated with these projects, and includes and these health impacts can be varied: cardiorespiratory health, other mental health issues, etc. And we have seen, we over the years have been involved in providing comments to a number of these projects. Often public health gets asked to assess for various reasons, either the climate change aspects or the air quality considerations. Sometimes it's a brownfield consideration, and we are bringing the health equity considerations to these projects. And we're looking to maximize the positive health impacts and mitigate any negative impacts associated with these projects. And sometimes these projects are large enough, often they are, where their regional council acknowledges the importance of weighing in with a health impact assessment to better understand those impacts. That doesn't happen with all projects, but it does with some. For example, large transportation corridor projects happening currently in the province has had that endorsement, or that acknowledgement rather.
Branka, can I just ask you to wrap up?
Yep. So I think that is it.
Thanks very much about that.
No, that's okay.
Thanks very much, Franca. That was really helpful and very descriptive. I think that's, for a lot of people in public health, that's really helpful to hear the details. We're going to turn the baton over right now to Charlie, and we'll save questions for the end. So again, if you have any questions, if you could put them in under the Q&A kind of chat rather than in the chat, that would be great. Okay, Charlie.
Hi everyone, I will just get my screen up and running. Hopefully you can all see my presentation. Thanks for having me join today. I am Charlie Mace, the Sustainability Planner at the City of Powell River. My pronouns are she, her, and I'd like to acknowledge how grateful I am to be presenting today from the traditional lands of the Sechelt and Squamish nations, and that Powell River itself is actually located on the traditional lands of the Clahaman Nation. So I'm going to spend the roughly next 12 minutes presenting about the Zunga Bus, which is our on-demand transit programme that launched in early 2021. Hopefully this feels relevant to you all. I realise it's maybe a bit different to kind of your traditional work area. Listening to Franca's presentation, I realised I should give you some context on where we're actually located. So I've just included this very quick map.
Charlie, excuse me, you're not sharing yet.
I'm not sharing. Oh my goodness. Oh, I've done it again. I didn't click the share button. I'm so sorry. Thank you. Can you now see it? Okay, I'm so sorry. I did this in the practice as well. Apologies, I have done presentations before. So this is the map I was trying to show you of where we're located, just for some context. So we're a small coastal community of roughly 14,000 people. We're 2 ferries away from Vancouver, so about 4.5 hours. And we've also got a ferry over to Vancouver Island as well. So quite isolated on our lovely little kind of coastal area. Let me just move this, sorry. So I wanted to start with some background on why as a city we came to look at on-demand transit and why it's been helpful for our community members. So being a small community, convenient public transportation can be a challenge. So some of you may be from a small community and might understand. In a low density neighborhood, you often have long wait times, long travel times, winding routes, and lots of transfers. So it might be that you can't make your journey from kind of to your destination without getting onto another bus. So often this isn't an attempt to provide wider coverage for everybody, but it does mean that it can become much more inefficient. We have quite poor, or in some places non-existent, pedestrian infrastructure. So we have a lack of sidewalks and very few bus stop amenities. So it can be a less than positive experience for folk taking transit. We also have an aging population above the national average, and I guess like many places, rising housing costs. This kind of all led to very low ridership of our kind of traditional fixed route bus services. We found that very few people were using them, and we really wanted to try and increase this ridership and therefore reduce the climate emissions associated with kind of car driving. So for some context, in Powell River, transportation makes up 70% of our community carbon emissions. So it's a pretty big target for mitigation efforts. A quick snapshot here of our public transit network, not including the Zunga bus. So as you can see, I think we've got approximately 6 fixed route kind of traditional bus routes that follow a specific route. They wind across the city. Many journeys require a transfer to complete. No bus really kind of covers the whole area. And generally speaking, it's just quite confusing and can take a while to work out how to make your journey. So one of the challenges we wanted to overcome was how to make the transit experience kind of more simple and efficient for residents. Putting this into context, here is a quick example of taking a typical journey in Powell River by bus right now. So someone living in our kind of northern neighborhood of the town site, traveling to their workplace in the south of the city, if they need to arrive at work by 9 a.m., they would actually have to leave home at 7:30 in the morning. So in a very small community, 1.5 hours is a very big commute. Comparing that same journey by car, it takes just 12 minutes. So hoping that really highlights the challenge we have in encouraging folk to use transit and leave their car at home. So a quick overview of what on-demand transit is. We did lots of research looking at other communities, both in Canada and beyond, and found that on-demand transit seemed to be a good solution that might work for us too. So it's a flexible and modern alternative to the traditional bus transit routes. It's well suited to low density areas, and the routes are created in real time based on rider requests. So instead of kind of one fixed route, hoping that people can get to the route, it goes to where the people are. So we have like a back-end computer algorithm that determines the most optimal route for the bus to take, and the riders share their rides and deviate from the route to pick up and drop off other passengers. So some of the benefits to on-demand transit include shorter waiting and travel times for riders. It can eliminate the need for bus transfers mid-journey, so you can get door to door on one bus without having to kind of make 2 or 3 changes. We can cover a much wider area of the city than a traditional fixed route service, therefore improving access to transit for more people. It's also a much more cost-effective service. We're finding we're spending roughly kind of half the amount on running Zunga bus than we are on our traditional fixed routes. A quick kind of overview of how we started our on-demand journey. So back in 2020, we saw a funding opportunity that was looking for 3 volunteer communities to trial on-demand technology. We were successful in leveraging $200,000 of federal funding from the 2020 Innovative Solutions Canada program. So we worked with a company called Spare Labs to launch the Zunga Bus pilot. So Spare Labs run our back-end system that kind of is the backbone of Zunga Bus. So this initial funding covered the cost of leasing 1 bus and the operation of the service for the first year. It didn't, however, cover the cost of a driver. So that was funded by the city, which we've since realized is actually quite a very big part of the fund, a big part of the costs. So it was initially just a 1-year pilot that we were hoping would help us use the results to kind of plan our future network. I'm going to give a quick overview of the service, the system, how it actually works on the ground as a rider, as well as share some preliminary results from the first few years of operation. So on-demand service can be either door-to-door, stop-to-stop, or a combination of the two. On the whole, Zunga Bus is door-to-door, so you can get picked up from your house and get dropped off at your doctor's surgery, at the supermarket, wherever you're trying to go. We also have included some stops. So we found that at some of the larger destinations, so for example, we have kind of a mall area that is very spread out. Drivers and passengers were actually struggling to find each other. So we have created a couple of stops just to kind of aid in that. We launched in early 2021 and we currently have funding in place until the end of 2023, so coming up soon. From the rider perspective, you can book a journey we have an app, or you can also book by phone. So we have a call center that's open during the service operating hours to support those who don't have a smartphone. And we found that it's actually been, I think, 1/4 of all trips are booked by phone. So it's really great that we kind of have that service as well. The flexibility of the service is really great. So you can book days in advance or you can just book in the moment. So we found that a lot of people are really enjoying this flexibility, especially seniors with the kind of traditional handy dart service. You have to book in advance and it kind of takes that spontaneity away. So you could just book now if you wanted to go and meet your friend for coffee, you can book on demand. So it's been really great. You're told the exact time that your bus will arrive, and you can also see, if you have the app, you can see where the bus is in real time on a little map. And as I think I mentioned already, the bus might pick up and drop off other passengers along the way, but we haven't found that this delays riders too much. And on average, if you're booking now to go and try and go for coffee, say, the average wait time is less than 15 minutes. A quick snapshot of the results from our first year of operation. Clearly, 2021 wasn't the best time to launch a new transit service in the throes of a global pandemic. Traditional transit had taken a real hit and loss of ridership, but we were ready to go and thought we'd launch anyway. So as you can see from the graph, we had a bit of a slow start to the launch, probably to be expected with any new public service, while kind of folk learn what it is and how to use it. But it also coincided with a big peak in COVID cases and social restrictions. So that kind of pinky orange color in the background there shows COVID cases. As the cases dropped, the ridership really started to increase, and with a slight dip again later in the year where we had another spike of COVID cases. We also, through the app, riders can rate their trip, and we had a 99% satisfaction rate from riders for the service, which we were really pleased with. I also wanted to include some rider reviews to help understand the real impact of the service to different users. So this one here is from a local senior, Pat. She said, "I use it all the time when I'm able. I don't know how I'd get around without it. So handy and so convenient. I don't drive and have trouble walking. I use it to meet friends at Starbucks, regular things. I'd for sure like the Zunga Bus to stay. I'd be stuck at home otherwise." And here we have another review from a mum of 4. I love the Zunga Bus. I'm a busy mum and it has cut my driving in half. My two older kids have special needs and go to inclusion programming. I booked the Zunga bus for them to take them to activities. It's given me more time and made my life much easier. I also have younger children, and previously they would have had to come along for the drive with me to drop off the older kids. So some kind of seeing the nice social impacts there of the service. And then in 2022 and 2023, you'll notice there's a 3-month gap here. So one of the main challenges we face with this service is drivers and driver availability. So in the early part of the year, there was another COVID outbreak early in 2022. So in the early part of the year, we were operating, unfortunately, with a reduced service because of this and just one driver. And then from March to June, we were just unfortunately unable to staff the bus. So it wasn't just Zunga bus, but our fixed route services were also impacted by this. But since then, we've been kind of consistently operating, which has been really great. And we've had quite consistent ridership numbers of sort of 200 to 250 riders per week. And we've also managed to maintain our 99% satisfaction levels. So also nice. I'll just start wrapping up now with some of the successes and challenges of operating Zunga bus over the last couple of years. So some of the successes include increased access to transportation for seniors and other segments of the population. We've been achieving consistent ridership numbers, so of roughly 3 to 6 passengers per service hour. We've managed to keep going beyond the pilot. So we're now 2 years, we've nearly been operating for 3 years now. We don't have any external funding for this. So traditional bus service in BC is normally split 50-50 between BC Transit and the municipality. Unfortunately for Zunga bus, we have no external funding from BC Transit. So city staff have so far successfully advocated for continued service for the last 2 years. We're currently in the process of doing this and advocating for the 2024 budget to be included. So wish us luck. And what else? So social connections. So the pilot was initially launched with the motivation to shift travel to sustainable transportation. But over the course of the pilot, it became really clear that there was many social benefits. This included the increased ability of residents to access community services, and also social interactions that occurred between passengers on the bus itself, like lots of lovely stories about seniors making friends, as well as the social interactions that occurred because it was just much easier for people to make spontaneous trips and meet up with friends. We've had really great feedback from riders. We undertook some, both through the app as well as some phone interviews we've done as well. So it's all been quite overwhelmingly positive, which has been really nice. Excitingly, last month, we won a Climate and Energy Action Award. So the photo there just shows our mayor and council accepting the award, which was a really nice recognition for the service. Some of the challenges include driver availability, which I've already mentioned. That does continue to be an ongoing challenge. We pull from the pool of the city's pool of transit drivers. So occasionally we do have to cancel service if there is a lack of driver availability. And accessible bus and service is also another challenge. So we currently lease 2 buses, but neither of them are quite right in supporting us to offer an accessible service for wheelchair users. So we do have one bus that is wheelchair accessible, but it's really not practical for our service. So if we have a wheelchair user on board, other riders cannot enter or exit the bus without having to ask or without having to help the wheelchair user off the bus and back on again. So really not practical. And long-term, yes.
Charlie, I'm sorry. Can I just ask you to wrap up, okay?
Yes, this is my last little bit. So long-term funding is our other piece. So we're hoping to eventually maybe get support from BC Transit. Very quickly, sorry for going over. My last slide is just to confirm what Zunga means. So Zunga is a Powell River word for rope swing, which there you go, local name. And thank you so much. Sorry if I ran over.
That's just fine. Thank you so much, Charlie. That was excellent. And just while I'm chatting here, Leslie, I would invite you to start pulling up your slides. But Charlie, that was wonderful. And I have to say, when I went through your evaluation report, I was really impressed by all the different people who really found that the Zunga service was like opening opportunities for them, like people with PTSD and war vets and single moms and older people. It was really quite amazing to see how many people found this really made a difference for them. So thank you very much. And over to you, Leslie.
Okay. Can everybody hear me?
We can see you and hear you. We can see your presentation and hear you.
Okay, I think I'm going to leave my video off if that's okay, because I live in rural Nova Scotia, and so internet connectivity is a bit of a challenge on the best of days, and today is not a very sunny day here. So I just want to start by saying I'm from Nova Scotia, so I'm joining, and I'd like to acknowledge that I'm joining you from the ancestral lands of the Mi'kmaq, the unceded territory of the Mi'kmaq peoples. This territory is covered by the treaties of peace and friendship, which the Mi'kmaq and the Mel-Cidi people first signed in 1725. So I'm with the Nova Scotia Community Transportation Network. And a little bit of context is we are the vital link between government, the transportation sector, and Nova Scotians. We are a not-for-profit organization. We do not provide actual transportation services, as lots of folks seem to think that we do. Nova Scotia is a very rural province. We have 2 urban cores in Cape Breton and in Halifax, and then the rest of our province is quite rural. And so for the average individual, if you wanted to access a carton of milk or to get to your job or whatever it is you want to do, you need to have your own vehicle, which is, it's really difficult for most folks, particularly in today's day and age. So one of the things that our organization does is advocate for accessible transportation. We also like to work to connect providers of transportation and supporters of transportation to share information, build networks, and identify innovative solutions to the transportation gaps that exist within our province. The third thing that we do quite frequently is work with government and advise on policy development that helps to support the growth for the underserved areas of the province in terms of transportation. Just a couple of graphics for you to take a look at. This is our work plan for just this year. So our work generally focuses in 5 core areas. We like to integrate service. We're not about reinventing the wheel or duplicating service. We like to focus on improving what exists. We like to promote and educate in terms of what exists. We like to connect what exists, and we want to make sure that it is available to the folks that need it. So whether it's the individual who chooses not to own their personal car and live in rural Nova Scotia, or that single mom who is a 1-car family and needs to get to the grocery store, or that individual who just isn't able to make that choice or shouldn't have to make that choice between food and transportation to access a job or a medical appointment, whatever the case may be. This slide is really busy, and I apologize for how busy it is, but I think it speaks to the landscape of transportation in rural Nova Scotia. So we're one of the smallest provinces in Canada, and this slide identifies the evolution of transportation throughout the province, particularly rural Nova Scotia, since 1981 to 2023. So every one of those little bullets is a transportation service within our province, which is a lot for such a small province. So we have a population of, I think we just reached 1 million people last year. The majority of those folks live in those 2 urban cores, and then the remainder live in rural Nova Scotia. And these are the various transportation services that exist that people have to be able to navigate. So as you can understand, it's quite complicated and confusing for folks. And it's not very well connected is probably the best way. My organization started working in 2000. So there had been a couple of pre-booked door-to-door accessible transportation services that had developed from 1981 to 2000. And they decided that there was strength in numbers and formed an organization, which essentially is the organization I work for, to be able to have a louder voice to advocate for services throughout the province with government of all 3 levels. Then from 2000 until 2010, 2011, there was modest growth, meaning that several local communities throughout the province saw that model in those early days areas and said, we could do something. We could have a grassroots solution to the transportation barrier within our community. From 2010 up until 2020, or also to current, we've had substantial growth in communities identifying their transportation barriers and developing a service that works for them. Unfortunately, though, it's not necessarily very convenient for folks who need to move from one community to the next for any given reason, particularly medical appointments. So this map displays all the areas of Nova Scotia, and each color indicates a different transportation service that is modeled after those early days services. So they are door to door, they are pre-booked, meaning oftentimes they have to give at least 24 hours notice. So unlike Charlie's program that provides that spontaneity, these programs do not. They are accessible, and lucky enough, their vehicles are convenient for accessibility, unlike Charlie's example of the bus that they have. Each of those organizations are funded by government in part. So the provincial government has a program that provides an operating grant and also a capital grant to be able to purchase vehicles. They have it's a mixed bag when it comes to municipal funding, and they are all operated as not-for-profits. So as you can understand, they struggle in terms of staff retention, fleet replacement, and just, keeping the vehicles on the road and moving folks around. The two white areas are currently the only gap areas in the province. So those are the two areas that there isn't any form of formal transportation available to residents. With that being said, by the end of this year, those two areas should have service as well. So in one area, a service is expanding to cover in that white area, and then in the other area a new service is being launched. So then that means there will be 23 independent not-for-profit transportation services throughout Nova Scotia. One of the things that our organization identified a couple of years back and worked with government to try and rectify a little bit is this has to be very confusing for the folks who live in rural Nova Scotia. How do you find out who to call or where to go to look for transportation to get you to a medical appointment or to grocery shop or to socialize or to get to work? And so the Transportation Network, funded by the province, created a website. And we worked with all 22 providers to be able to have a website for each of those individual organizations at one web address that had a similar look and feel, so that folks could, regardless of which end of the province they lived in, could be familiar with the website, how to navigate the website. And this also created the opportunity for us to talk with those organizations about some of the standardizations that they could possibly undertake in terms of their booking process, their fare structure, and all those pieces that make it just a little more user-friendly for the individual who needs to access transportation. The other thing that's come to light over the last number of years is there's real need for folks to move about, not just from a pre-booked or an accessible standpoint. And so traditionally, Nova Scotia had two fixed route transits, and they were in our urban cores. They were in Halifax and in Cape Breton, Sydney, Cape Breton. However, over the last, I'm going to say 5 to 6 years, we've seen substantial growth in the number of fixed route transits that we have in the province. So that's what you see displayed on the screen. Some of the fixed route transits, for example, Pictou County Transit, partners with that door-to-door service. So similar to Charlie's example of they share drivers, they share vehicles, but they offer a fixed route within the urban area of their geographic region, and then they do the door-to-door in the more remote areas. So now we're up to 9 fixed route transits in the province. And of these fixed route transits, they also receive similar operating and capital grants from the province, as does the door-to-door services. The other piece that is important for Nova Scotia and being able to get from one part of the province to another is we have a long haul service. We're fortunate enough to have a long haul service or a line haul service. So similar to what used to be Greyhound in the western part of the country. It's a private business though. And so my organization has been working quite closely with the private sector, particularly this service provider, to be able to expand his service within the province. So back in 2018, we undertook a project with this private provider, funded in part by the province, to expand their service down the south shore of Nova Scotia. So up until that point, folks could move within their communities, but they couldn't move from community to community. And if you had to travel from the South Shore into Halifax for a medical appointment, you either had to travel by car, your own personal car, or you had to have somebody who could take you in a personal car. Taxi services are not available in most of our rural areas, or else you just didn't go. So one of the great things about partnering with private business is there's that opportunity to link them to those other not-for-profits and to see how they can work together better and not duplicate service. So as you probably all have figured out through my presentation, there are a huge number of transportation options for Nova Scotians, depending on where you live. Some may be available to you and some may not. As an end user, it's very confusing to even know what your options are. So just last year, we partnered with the province of Nova Scotia and did a bit of an asset mapping project to see what services were available throughout the province. And then we decided to host a website that has a find a provider near you page on it, so that folks have a one-stop shop where they can go, they can figure out what transportation options are available to them where they are within their province, and then how they connect with them. And what we're seeing is this is growing considerably since COVID. So during COVID, as was the case with Charlie's group, the ridership decreased in all of the various forms of transit available. But since COVID, folks are really needing to move around, and the availability of a personal car is not there for a lot of folks as it had been in the past. And so we're seeing the traction of this website take off, both from individual residents to care providers to various service groups are using it and reaching out to us. Anyway, it's definitely something to help pull all that disjointed transportation options in the province together. And so lastly, I said that we're a not-for-profit organization and we don't provide transportation. We like to link people. And so we have our website, which is where that Find a Ride page is hosted. We produce a monthly e-news, and we also connect and promote things through social media. And I encourage any of you to reach out to us and be added to our monthly e-news, or to follow us on Facebook, or to check out the resources that we've made available on our website, including the Find a Ride page. And I think my last slide says questions, which might be a good timing, Kim.
Thank you so much, Leslie. And I want to thank all three of you. I know it's really hard to cover so much information in so little time, and you all did an excellent job. So thank you so much. Again, I just want to say with Leslie's example, so both Leslie and Charlie are talking to us about projects that are not being kind of run or kind of supported strongly by public health, but public health really cares about public transit and understands how important it is to health equity and health in general. And so I really love these two examples. I think, Leslie, there's many communities in Ontario where it's almost impossible to get to them without your own vehicle. So I think it's just incredible that you have that. One question here for you, Charlie, from people on the Q&A here is, can people who have mobility challenges use your service, the Zynga service, or do they need to use the other service, like a specialized service?
Yes and no. So we hoped our accessible bus would allow kind of wheelchair users or other mobility devices, but it's been quite impractical kind of while kind of in operation. So Handy Dart is mainly the kind of the service that's promoted for those users. We're hoping early in 2024 that we can get a new accessible bus that will, our bus lease is coming up, the end of the bus lease is coming up, so we're hoping we can try and get a more practical bus for our service, so hoping to fix that soon.
Okay, and then for both Leslie and Charlie, I don't know if either of you feel you can respond to this, but I guess there's a question as well about recognizing pedestrian infrastructure, and I guess kind of that would apply to people in mobility devices as well as those who are not using those. Is there any work to try and, like, is that an issue, or is that something that's being addressed as well in your projects or your communities? That's a tough one to answer, but if you can.
Go ahead, Charlie.
Yeah, so we definitely at the city have a program where we're trying to improve our pedestrian infrastructure. It's definitely a slow process over probably many years. We are a small city, we don't have huge amounts of funding. It's very expensive to do kind of new concrete work, but we are slowly rolling out new projects. So we are very good at looking for grant funding for a variety of projects. So we have a couple of new projects in the pipeline over the next year, kind of improving, either building some sidewalks where we don't have them, putting in drop curbs to allow those with strollers or mobility devices to actually be able to get on and off the sidewalk. So yeah, it's definitely, we are trying, but it's definitely kind of a slow work in progress.
Thanks, Charlie. And then what about you for both of those issues?
So here in Nova Scotia, we are just working our way through the standards for our accessibility legislation, and transportation is one of the focus areas. So my organization has been invited to advise on the development of those standards, and we're able to connect with the various service providers and users of transit throughout the province to be able to have that first voice and second voice in the development of those standards, which then will be passed along to each of the organizations, the municipal units, to be able to implement those standards. So but it is a challenge. I mean, in rural Nova Scotia, in the urban centers of the communities, there may be sidewalks, but we're very rural, and it's challenging.
I can see how it would be. Then can I just, we'll just switch over here to the tree planting for a moment, or not tree planting, but the Greenspace work that Franca, that you were speaking to. One of the questions here is, community health centers, are there ways that they might engage more with public health units to help advocate for kind of health equity being addressed through kind of green space, tree planting, that kind of thing?
Thanks, Kim. I think it's Linnea. Public health often works with this sector. I can only, in terms of Peel, and each, it may look a little different in terms of the mechanisms to do this, but we in Peel, we have kind of structured processes. We have something called a community response table, where we have a number of groups come together there, where where the region is a member, along with a number of other agencies, including community health centers and the nonprofit sector, where it is that opportunity to raise issues, but there's also just directly reaching out to individuals in the program areas that might be working in this case, in either tree planting or in health, on climate change and health, and starting that conversation. There may be other opportunities in that regard. In Peel, we have, for example, a well-established heat warning notification system where we work with this sector. We engage, we notify them when an event happens, but we also periodically, as we did this year, reach out, have the discussion about where the gaps are, provide opportunities to inform new work or ongoing work for enhancements. So it's really, reaching out and developing those relationships to see where and what opportunities within the specific health units and how they do that. Hope that helps.
Thanks, Franca. I want to go back to Leslie. You did mention about the pandemic, but I do recall, kind of when I had the chance to interview you guys, that with the pandemic, you actually had a special relationship with healthcare providers. And I think that would be interesting for other people to hear about, just in terms of understanding or appreciating the value of the service that's being provided year round?
Yeah, we did. So during the pandemic, we undertook a fare subsidy program for folks to be able to access COVID-19 vaccine clinics throughout their areas. And we partnered with those 22 community-based organizations to provide the transportation. So Nova Scotians were able to access a vaccine clinic for a $5 flat rate, whereas the fare-based service could be anywhere from $20 to $100 to access the closest vaccine clinic, and we subsidized the remainder of that fare so that folks were able to access clinics. Yeah, and it was very well received.
Yeah, I bet. I just want to say, I wish we could, I'm sure we could have a lot more conversations, but we have 2 minutes, so I'm going to pass things back over to Ian and thank the three of you very much. Like, these are really interesting projects and really inspiring for the rest of us thinking about how we might kind of build on what you've done. So thanks so much.
Thank you.
Thank you so much, Kim. Thank you, Charlie, Franca, and Leslie. Great presentation. And thank you, everyone, for your great questions and participating in today's webinar. So as Kim mentioned at the top of the hour, today's webinar has been recorded and will be posted to CPHA's YouTube channel very soon, probably early next week. And as soon as it is available, everyone who registered for today's webinar will receive a notification from CPHA. Please take a moment to complete the survey that you're going to be redirected to when you leave today's webinar. And have a great day. Stay well and take care of yourself and be kind to each other. Goodbye.